Hi, hello. Today we are going to discuss about cytology remaining parts. Today we are going to discuss about troubleshooting in cytology. In cytology, three main type of errors can occur. One category are diagnostic error by the reading the pathologist due to a condition that look uh, equivocal or the difficult to diagnose on cytology. Lacking of immunohistochemical stains or other ancillary diagnostic test or the lack of training or experience. The second category are technical error due to a faulty smear taking or preparation of stain slides. Uh, and The last but not least are documentation error, which can lead to erroneous reports being issues with potentially uh, disastrous results. So, the quality of the smear is of a paramount importance to reporting uh, since only a small sample of cells is looking at and the tissue architecture is not seen as in histology sections. It is essential that the smears are prepared and stained optimally to obtain maximal information from the diagnostic material. Reading an inappropriate prepared smear can result in diagnostic errors. Most of the time, there is a little or nothing that can be done to rectify an error once a smear has been prepared, and with limited material, this is something to keep in mind. Hence, most of the troubleshooting steps in this step are about prevention of such errors from occurring. Doing repeated smear due to technically unsatisfied smears will cause unnecessary delays and further discomfort to the patients. For this reason, this is imperative that the technical aspects of obtaining the smear stages in preparation, such as sample storage, transport, centrifugation, smearing, fixation, staining, etc. So, as well as documentation and record keeping are performed very carefully. So, here we will move into the errors in sample taking. So, when we consider the non-gynecological uh, cytology, so first missing the lesions. So, the how to prevention, prepare a positioning of the patient, perform aspiration with good lighting, identify the lesion. It helps to refer the scan finding. Image guided aspiration should be done of poorly visible or poorly palpable lesion. Get a good grab on the lesion, immobilizing it when performing fine needle aspiration. Angulate the needle and or sample multiple areas. Second error could be scanty cellularity. So, how to prevent obtain adequate sample with multiple passes. If fluid is obtained, centrifuge to concentrate the cell. Use of aluminized slide for watery fluid will increase the cell adherence to the slide. So this smear can also be used for the immunohistochemistry because so cellular if our smear contain scanty cellularity if when you are using albumized slides, so it's keep the cells. Otherwise, during the processing, staining, fixation, and all the things, sometimes there is a possibilities to uh, removing the cellularity. So next one is contamination with blood. So here prevention use non-aspiration needle jab technique for FNA where the possible. Minimize tissue trauma. So and use liquid-based cytology preparation if available or lyse RBC. So you can do uh, if the blood contamination is possible. So next one is spillage or loss of material. So send the fluid in a screw cap container with a well fitting lid. So this also applies to smear sent in fixative. It is not satisfied to send fluid obtained by FNAC in the syringe itself, as this can result not only in loss of material but also air dry artifact we can see. So dried unstained smears can be sent in a box, taking care that the slide surface do not touch uh, each other or the packing material. So next one is the contamination by squamous or other epithelial cells. So squamous cells and similarly other epithelial cell can appear in the smear if the needle obtained the sample went through the epithelium. Scammers can also exfoliate from the hands of the person preparing the smear. This can lead to a wrong diagnosis. So next one, when we consider the errors in handling of cytology samples. So this is during the handling of cytological sample. So stick smear. How to prevent uh, digestion of thick mucus. For example, if the sample is sputum, using enzyme, add 8% hydrochloric acid or ultrasonic treatment to reduce the thickness, right? So next errors problem, contamination with blood. So how to prevent this? Centrifugation or lysis of red cells. Third problem is cell degeneration and the fungal contamination. So, how to prevent this? Avoid delay in smear preparation. Do not leave the fluid unattended for long period of time. So, cross contamination. So, how to prevent? Avoid slides sticking together in container. Avoid putting slides of two different patients or the side uh, in one jar. Use fresh staining and fixative solution. Filter regularly. Use clean jar and container for entire procedure. So, in the case of centrifugation or the lysis of the red cell, due to the contamination with the blood, so specimens that are heavily contaminated with the blood are difficult to report as the diagnostic material on the slide will be uh, obscured by the blood, right? So, acetic acid or canoic fixative or saponin or streptolysine can be used to lyse the red blood cell, but it is better to separate off the blood by carefully centrifugation, as it causes less problem with staining and the cell identification. Red cells are more dense than other cells and therefore settle at the bottom of the tube with a buffy coat containing white blood cell, etc. Above the red cell layer, which separated it from the other cells, that's mean diagnostic material on top. This separation can be enhanced by using flotation material. We call histoflap. Right? This material has a density in between that of the two uh, of the red cells and the other diagnostic cells in the fluid. Therefore, when the sample is centrifuged with this material, the blood red blood cells will go to the bottom and the diagnosis sample of cells will be suspended in the medium above the red cell. So we can easily collect our sample. So when we consider the cell denaturation and the fungal contamination, so fluid should not be kept unattended at the room temperature. Refrigeration can preserve fluid for varying length of time. Specimen with a high mucus content such as sputum, bronchial aspirate, mucosal fluid can be preserved for 12 to 24 hours. Specimen with high protein content such as pleural, peritoneal or pericardial fluid can be preserved for 24 to 48 hours. Specimen with low mucus or the protein content such as urine or CSF will be well preserved for only 1 to 2 hours even if refrigerated. Specimen with low pH such as gastric material must be collected on ice and be processed within minutes of collection to prevent cellular destruction by HCl. So, specimen that are heavily contaminated blood, so we can use acetic acid or saponin or streptolysine for lysis of the red blood cells. So next we will move into the errors in a smear preparation. So thick smear. So too many specimens are placed on the slide. How to prevent this? The thick smear. Too many specimens are placed on the slide. The specimen droplet should not exceed 3 to 4 millimeter in diameter. So to prevent the thickness, spread the smear properly. The next error is covering of sample by label or improper cover slipping. So how to prevent this? Sample should be placed 1 centimeter from the frost or labeled end of the slide. So all material on a slide is important for interpretation. So therefore make sure the cover slip cover the entire smear and avoid air bubbling. So next one is the poor fixation or air drying or air artifact. So how to prevent these poor fixation and the air dry artifact? The smear should be transferred to the alcohol for fixation as quickly as possible. When used properly prepared fixative, that means normally for the fixation we will use 95% ethyl alcohol. So we have to properly prepare. And other thing, immersing the slide briefly in alcohol before smear taking and preparation, because dry or wipe excess alcohol may increase fixation and uh, and the cell adherence to the slide. So next one is crush artifact and cell destruction. So how to prevent this? So do not use too much pressure when smearing. If centrifuging specimen, use proper speed and the time to avoid the cell destruction. So next one is improper staining. So this is the another problem. So how to solve this or prevent this? So follow proper procedure when preparing staining. Do not use outdated stains and filter off stain particles. So sometimes if the stain contain stain particles, so it interfere our interpretation of the cells morphology. So here you can see the thick smear, low magnification. The thick smear of the preparation make it impossible to see the cells properly to make the diagnosis. So this is very thick. So this is not a single cell layered. So the second picture, the thick smear, high power. These three-dimensional cell cluster make it very difficult to evaluate the cytological features of each individual cells. The features are obscured by cells on top of one another. So what happened? This is overlapping. Sometimes it lead to wrong diagnosis. Better to prepare thin layer. So here again brown colored cornflake artifacts, right? So next one, cross contamination is another problem. How to prevent? Avoid slide uh, sticking together in a container. Avoid putting two different patients or sites sample on one jar. So here cross contamination due to two different patient samples when you are putting into the staining or smear preparation. Sometimes if it may contaminated from one person's slide to another person's slide. And other thing, when you are putting two slides in a same jar, so we have to avoid the smear side in both smear side in same side, right? Use fresh staining and the fixative solution and filter regularly. Sometimes if the previously used if we use fixative stain and other things, but it contains this detached cells, it may adhere to the current smear. Sometimes may lead to wrong diagnosis. Use a clean jar and the container for the entire procedure. So here also, sometimes if when we are using, we can avoid the cross contamination. And corn flake artifact. This is a brown artifact in thorough to occur when there is a delay between the removing the slides from the last styling and applying the mounting media. The brown artifact is thought to be a air trapping within a surface grooving of mature squamous cells. So next one is right in here. Other air contamination include insect, so dust or fallen on the smear or the muscle fiber in a sputum sample which came from the meat left in the mouth by the insect. Cells can lose nuclear detail and show cytoplasmic occultation if unstained smear are stored in a biohazard cabinet under UV light. So these are the problem. One is the insect, other one is the when we storing uh, under UV light. Next one is the errors occur in pap smear. Normally, in gynecological cytology, we use pap smears. Several errors in smear taking and preparation or the sample itself can cause a smear to be unsatisfactory or inadequate. Some errors are common to both gynecology and non-gynecological cytology, like a thick smear, air dry, blood contamination, crush artifact, poor staining, and the cover slipping, etc. Other errors are that occur when sampling the cervix. That's mean the pap smear taking in particular. So here we will discuss that. So the partial sampling of cervical is the cervix is the first errors or problem. How to prevent the entire circumference of the cervix should be visible and sample 360 swabs when the sample is obtained. Make sure to sample the transformation zone. Use an endocervical brush if necessary. So next problem is scanty cellularity. How to prevent this? Uh, Collection for other tests, for example, for the sexually transmitted diseases, should be done after obtaining sample for the cytology. Contamination by medication or dodged sperm. So this is the one other problem. How to prevent this? At least 2 days before the test, women should avoid sexual intercourses, uh, dashing, and vaginal cream or suppositories or the spermicides. The for fixation, so how to prevent this? Make sure the slide with the smeared material come in contact with the fixative immediately. The one is the thick smear, so care should be taken to spread the material thinly and evenly on the slide. Other one is the blood contamination. So how to prevent this? Avoid the smear taking during the menstruation and sometimes blood contamination due to when you are applying when you are taking sample when you are apply force high forces sometimes it may injured, so to avoid that situation also. And streak artifact or crushing of cells, so how to prevent this? Do not prepare the smear too vigorously. Material should be separated gently but rapidly on the slide. So next one is excessive uh, cytolysis. So how to prevent this? Cytolysis is the deintegration of six squamous cells by the action of um, lactobacilli, when which is occur most toward the end of the menstrual cycle. This can be avoided by taking the smear mid-cycle, that's mean at or just before the time of the ovulation. That's mean they 10 to 20 days after the last menstrual period begin. Then next one is lubricant or spermicide gels. So here lubricants should be applied in the minimum necessary amount to the outside of the speculum or using a warm water instead of lubricant. It is ideal that the smear is performed before the bimanual examination, again to avoid lubricant contamination. Spermicidal gel should not be used for at least 48 hours before the test. Next one is obscuring by neutrophil. So neutrophil strict to cervical mucus. Therefore, if a mucus plug is seen at the cervical opening OS, so it should be gently wiped off with the swab before taking the smear. So these are the errors during the collection, right? So the American College of Obstetrician and Gynecologist guideline for proper cervical smear taking. So we can follow that one. The presence of endocervical or metaplastic squamous cells denoted satisfactory sampling of the cervical scare colonna junctions, right? So next we will move into the documentation error. Errors in documentation. So utmost care in specimen handling, smear preparation, and reporting can be completed neglected by inadequate or inaccurate recording of information. These include the following. The The first one is the cytology specimen should be accompanied by a completed request form. Any missing or wrong information would be uh, detrimental to the results of cytological reporting. So therefore, they should be include the request form, right? The patient information details such as name, age, sex, BHT, or clinical number, ward, uh, hospital, reference consultant, etc. And right, and it should be indicated what sample is or where it was taken from, and the indication for the test or differential diagnosis results of the previous cytology, other relevant laboratory or radiological investigation should be included where relevant, right? For example, for the thyroid FNAC, the thyroid scan report and the thyroid hormone level would be useful, right? When we consider the nature and the method of sample collection should be also be mentioned in the request form, right? Whether it is cytobrushing or spatula or liquid based cytology for the gynecological sample, and plain or guided FNAC for the aspiration smear. For the cervical smear, age, date of last menstrual period, macroscopy or colonoscopical appearance of the cervix, use of an intrauterine contraceptive device or the hormone therapy, and the results of the previous smear are item of information necessary to make an accurate assessment of the results. Lack of such information will result in wrong interpretation. So, if the report is being sent to an outside hospital or clinic of the patient, the address to which the report is to be dispatched should be mentioned correctly in the request form to avoid the loss of report. And mention the date and the time of receipt of specimen on the request form as well as in the specimen reception record. This will enable tracking of the specimen and reduce the documentation error by providing a way of seeking or checking with wards or clinic records. It's also important for the audits of turnaround time, right? Oh, other thing, if a bottle of fluid is sent, the patients and the specimen uh, identification detail on the bottle label should match those on the request form. If slides are prepared, the laboratory reference number given on the slide label must match the given to the request form. Incorrect labeling will result in mix-up of slide and the reports. Right, next one, care must be taken when the assigning a laboratory number to avoid duplication of such numbers, and the assigned number must be entered against the patient sample in laboratory record and the reports. Mistakes made can result in the mix-up reports as well as the difficulties in tracking, raising or past records. Another thing, the microscopic appearance of fluid is very important as it provides a clue to the diagnosis. It is essential that the volume, color, turbidity, or the clarity of the presence of bloods or pus or the any decoloration or autolysis due to putrefaction are recorded on the form given for reporting or by the receiving technical officer. If prepared smears are received, the number of the specimen from each site. If multiple sites, and suppose if we receive multiple sites, so we have to note it down, and whether the received specimen is wet fixed or airtight, or need to document all the things. Then another thing is match all the slides or the specimen bottle with a request form and not any mismatching numbering, etc. So that's all about these things. These are the references. So when we get the summary, so troubleshooting in the cytology involving detecting and solving the problem that can occur in various aspects of the cytology reporting. The problems that can occur are mainly in three categories: technical, diagnosis, and the documentation errors. Many of these errors are preventable, and it is therefore useful to know the cause are prevented by good practice such as filtering stain, methodological record keeping, while other errors can be reduced by experience. For example, reducing blood contamination when FNS is sampling, or the recognizing artifact or minimizing diagnostic errors. The main attributes a technical officer need to prevent errors are a sound knowledge of the technical and the documentation procedure, commitment, and the experience. So that's all about. So we will meet another session. Bye.